Experiencing a rotator cuff injury can be painful and frustrating. Rotator cuff injuries can limit your activity and your range of motion, but Middlesex Health can help. Middlesex Health orthopedic surgeon and chair of the Department of Surgery, Dr. Mark Lorenz, joins us. Doctor, thank you for being here.
Good morning.
So how typically are people injuring their rotator cuffs?
Well, typically it can be from a traumatic event, or it can also be from overuse. Sometimes part of an age-related process as well. Sometimes people will fall into an outstretched upper extremity and injure themselves, or oftentimes it can be part of a wear and tear phenomenon where over the course of years the rotator cuff sort of wears out and becomes problematic. And
when is the time to see a doctor? Once the pain gets too much, or you really have a range of motion that's not there?
Both, but it's usually pain that brings patients to the office. Oftentimes patients have difficulty performing overhead activities, reaching with their arm. Sometimes patients will have a lot of pain at night when they sleep that'll wake them up from sleep. Those are usually the reasons people come into the office to see an orthopedist.
And what are the treatment options? Is it surgery right away, or are there a couple steps you could take ahead of that?
Usually we try conservative approaches first. We do things like use anti-inflammatory medications. We oftentimes the orthopedist will give cortisone injections to reduce the inflammation. We'll try some physical therapy, activity modification. If that fails, then we may go on to do an MRI scan, which is a test to look at the status of the rotator cuff. And if the injury is severe, there also are some patients who will require surgery. But we try to avoid surgery if we can.
Sure, that makes sense. And how would you say that Middlesex kind of separates themselves from other healthcare facilities?
Well, we really are, our hospital and our OR and our surgical centers are designed for this type of surgery. We do a lot of arthroscopic surgery, and we have protocols in place for patients post-operatively that really maximize their recovery. We have a lot of physicians on staff who are very aware of this injury, who treat sports-related injuries, quite frequently. So we really feel like we have a lot of experience to treat these injuries. And
what is the downtime if, in fact, you do have to have the surgery?
It really depends on the severity of the injury. It can vary. It's not a quick recovery oftentimes. And some patients will require even a year of recovery sometimes. But it does depend on the severity of the injury.
So walk me through a patient's first visit. They have the pain, it's time to see a doctor. Where do you start?
Right. Well, we take a history. We ask patients, when the pain is at its worst, when it's better, what helps it, what makes it aggravated. We usually do an examination, and we take x-rays in the office. And then we decide what the treatment plan is from there. And depending on how that treatment plan works, sometimes we need to do an MRI scan if patients don't improve.
Sure, that makes a lot of sense. Where can we find you?
So I'm part of a group called Connecticut Orthopedics. We're a large orthopedic group along the shoreline of Connecticut. I work at Middlesex Hospital. I'm the chief of surgery at Middlesex Hospital. So we have websites, and our website is middlesexhealth.org. So that would be a great place to start and discover us.
Very good. Thank you so much for being here and for all the information.
Thank you very much.